Hello everyone and welcome back to my channel. My name is Cindy. I am a 5th year MD-PhD student and today we're going to be talking about interviews because believe it or not, interview season is upon us. Now this video is going to mostly be focusing on traditional interviews rather than MMIs because that's where I feel like I have the most, expertise, if you could call it that, and experience. But if you're interested in preparing for MMIs, learning what MMIs are, what are some strategies of dealing with MMIs, I will put a link in the description down below of the exact book that I used when I was preparing for my interviews for MMIs. I will also be talking a little bit more about MD-PhD interviews specifically in another video, so watch out for that. Okay, so my experience with traditional interviews come from, two main sources. One, having done a lot of interviews myself, both in kind of the professional context for corporate internships and also for medical school interviews. The second kind of experience I've had with interviews is on the other side of the table. So when I was in my gap year position, I was actually in charge of interviewing who was gonna be my replacement, essentially. So I thought it was really cool being on the other side of the table, screening resumes, asking people questions, and coming up with the questions to ask them about their application. And that brings me to my first tip, which is to know your application. This might seem really obvious, but you would also be surprised how many people show up and not know exactly what they put on their application, or maybe they don't remember what they put on their application. You submitted your primary in June and secondary in July and August, and interviews can be anywhere from September to February. And so what I would recommend is the day before your interview or 2 days before your interview, read the whole thing again, know what's on your resume, know what you sent to the school. And while you're reviewing your application materials, you can also kind of try to anticipate what sorts of questions might come up. So for example, you really struggled with your GPA your freshman year. Now that might come up in an interview, so you have to be prepared to explain that. If you did a ton of research all throughout your years in undergrad and you wrote about it a lot in your application, be prepared to talk about research. Basically, know what you highlighted in your application, know what you talked about in your application, and then make sure you're able to talk about it. Another thing I want to remind you guys is if you use nicknames for your patient anecdotes in your application, so for example, instead of the patient's real name, you called them John or something, make sure you know what name you gave them, because at the interview, they might be like, oh, I read about your experience with John. You don't want to be caught off guard and be thinking, who the heck is John? Who did I call John in my applications, The next thing you want to prepare for is what I'm calling the common questions. Obviously, you can't possibly anticipate every single thing that comes up. Sometimes interviewers just really like to throw curveballs at you. They're trying to stress test you, whatever. But questions like, tell me about you. Why do you want to be a doctor? Tell me about a meaningful clinical experience that you had. These are questions that you should have answers for, at least have some structure. You don't want to sound scripted, so don't go and practice a script that you recite word for word. But when it comes to those questions, know what you want to hit on, know what you want to talk about. Down in the description box, I will link a free resource that I found on Reddit with a lot of these common questions. A resource that I personally used when I was preparing for interviews to kind of get a feel of what types of questions are out there is actually this book by Dr. Gray. It's the Premed Playbook Guide to the Medical School Interview. It is reasonably priced on Amazon. I will also put a link to this down below. There's literally lists and lists of questions organized by opening questions, grades and MCAT score questions, all the way to policy and healthcare questions, and then the miscellaneous questions, which is funny because there's a lot of wildcard ones here. I'm not saying necessarily to focus on every single question that is in this book, but it's good to get a feel of what's out there. And what I like about this book as well is that there's actually sample answers for some of the common questions, like tell me about yourself, and that might get you a good feel for what other people are saying and the critiques. But that's enough about this book. Another thing you want to be able to prepare is questions for the interviewer. I wouldn't prepare a whole ton of these questions, maybe just one or two, but I would make them different for faculty versus student. For example, if you're having an interview with a faculty member, you're not going to be asking them, oh, what's the attendance policy for lectures? That's just not a relevant question for them. For faculty, I'll probably ask them more broadly about the school and the program. So for example, what do you think of the medical school curriculum here? Do you think the students here get good training? I do remember generally asking my interviewers how they've liked being at that school, how they've liked working with medical students, if they have a role in medical education, etc., etc. And I feel like they're always pretty happy and passionate about their work, which, as you can imagine, the people who are, volunteering to do medical school interviews tend to be the people who are happy to be there and want to get good people to come to their school. If you get a chance to ask students questions, these would typically happen during like more informal times. So when I had Zoom interviews during my medical school interview days, students would pop in and do Q&As with us. When you're talking to other students, it feels more low stakes usually because they're kind of like a peer. Obviously, remain professional, all of that stuff. But in those cases, if you get the chance to talk to students, feel free to ask more broadly about their experience being a student. Like, what is their favorite thing about the curriculum? What's their least favorite thing about the curriculum? Ask them about their extracurriculars, other research opportunities, things like that about student life that they would be able to answer. One of my favorite questions to ask the students when I was interviewing was, one, whether or not they felt like they were being adequately supported by their program, and two, whether or not admin and school faculty are receptive to student feedback and whether or not they're able to give feedback at all. My next piece of advice when it comes to preparing for medical school interviews is making sure that you get the reps in. Make sure you practice. I am not telling you to go out there and look for, one of those $10,000 paid mentorship programs. That's totally unnecessary in my opinion. I wish I could make a video about that without, potentially getting in trouble. Just ask someone to give you a mock interview. If you have a physician mentor or a research mentor and you guys have a relationship where you feel comfortable asking this, then please do it because they will be your number one resource in this situation. They're at that level in their career where they're evaluating students on whether or not to admit them to their school, for example. It is also totally okay, even if you don't have like a physician mentor or a research mentor where you feel comfortable asking for a mock interview. If you have a friend in medical school, ask them to practice a mock interview with you. If your school advising program offers mock interviews, schedule one. The people who give you mock interviews don't necessarily have to be a medical student or even be in medical school in order to give you valuable feedback on the traditional interview format. So for me, most of my mock interviews were actually done with my friends who were already working in industry and had a few years of industry work down their belt, and they were able to give me incredible feedback on my interview answers. The bottom line is you want to be able to do mock interviews so you can get the flow of it to make sure your answers sound, not panicked and natural, but also not scripted. And then you want, ideally, people who can give you good feedback. And I know people also say, oh, you can film yourself answering the interview questions and then like critique yourself and then practice by yourself essentially. But honestly, I think that's a little less effective than having a third party like critique your answers. And I would really only go the recording yourself route if I have no other option. Obviously, you can do the recording yourself route on top of mock interviews, but I don't think it replaces mock interviews. The next two things are a little bit more practical, the first of which being keep your answers at a reasonable length. Obviously, this is where practice is gonna help because if all your answers are really long, someone will tell you during these practice sessions. But see, this is my point. If you only record yourself instead of doing mock interviews, you may think your answers are fine because you kind of know what you're about to say in the iterations where you're like talking to yourself and such. But a third party will definitely know if your answer is getting a little bit too long. And why is it important that you keep your answers at a reasonable length? Well, ideally, an interview is like a dialogue, like a conversation, not a monologue. Like you don't want to be stuck on tell me about yourself and start regurgitating your application for 15 minutes because I guarantee you your interviewer will not be listening past like minute number 3 or 4. I have sat on the other side of the table as an interviewer where I ask my interviewee a question and they just start going on and on and on. And eventually they get on a tangent and never answer my original question. And I also find myself sometimes like zoning out and eventually losing the train of thought if the answer is way too long. A good benchmark for like the amount of time you should probably try to remain under is 2 minutes. If you've ever been an interviewer and heard a 2-minute answer, you will realize 2 minutes is actually quite a long time. And so in this case, if you know that about yourself, that you tend to go on and on or tend to go on a tangent, then I would definitely try to practice with someone and ask them for feedback. Hey, are my answers too long? Like, did you feel like I was kind of like losing the plot when I'm talking? The next piece of practical advice I have for you is the anything else question that could come up at the end of your interviews. And I always bring this up as a piece of advice because one of the med students I had a mock interview with back in the day told me this, and I just thought it was actually such a good piece of advice. So at my mock interview with her, we got to the end of the interview and she asked me, oh, is there anything else you want to add? And I just said, nope. thank you, because I was like, what else is there to add, you know? But then we got to the feedback portion of the mock interview, and she told me that the anything else question is actually an amazing opportunity to add something that you did not get to talk about during the interview. In fact, she told me that if my interviewer gives me the opportunity with the anything else question, I should almost always take it, because my application is rich and it is almost impossible to cover every single facet of it in just 30 minutes. Basically, the tip she gave me was to have a mental list, or if you're in the Zoom format, you can have a physical list if you want, but eventually it's a mental list. But have a mental list of things you want to touch on in your interview. So like, for example, for me, I wanted to talk about my assisted living volunteering, my research, my crisis text line volunteering, and I also wanted to make sure I talked about my statistics department teaching assistantship, and I wanted to talk about my involvement with music at my university. So let's say my list is those 5 things, and we end up not talking about my teaching assistantship experience. And so when the interviewer asks me, hey, is there anything else you would like to share? I might be able to answer with something like, well, actually, we never got a chance to talk about my experience as a teaching assistant, blah, blah, blah. And this was really meaningful to me and my application. So I would love to share a little bit about that. And, you know, I would get to share a little bit about that and why I brought it up. And that would be that. I did get to use this a couple times during my cycle, and I feel like it's a really good opportunity to just highlight yourself in another way that didn't really come up in the interview. And to finish off this video, let's talk a little bit about nerves and anxiety on the day of the interview. The first thing I want to say about nerves and anxiety is that it is absolutely okay to think before you answer an interview question. Now, you're not going to need to do this for every single question, especially if you've had some practice beforehand, but let's say an interviewer gives you a question that you were just completely not anticipating. It is okay to pause, take a deep breath, and then answer. When I was interviewing, sometimes I found myself needing more than just a deep breath, and in which case I would literally just ask, that's an interesting question. Can I take a brief moment to think about this? And usually the interviewer is cool with that because, like, I don't know, like, it is normal to have to think, and it actually shows that you're thoughtful about it as well. And I'm not telling you to take 3 minutes to think about it. I'm not even really telling you to take a whole minute to think about it, because at some point it's you and the interviewer just staring at each other, and it's really awkward to like have that silence hang over you guys. What I'm trying to say is take 5 to 10 seconds to think about it. At the very least, give yourself enough time to stay calm and collected before you start answering the question. And it does make a difference, because let's say you get a question that you're not anticipating at all and you start panicking. And either you blurt out the first thing that pops into your head, or you start going in this roundabout way, trying to make your way to the answer, and then you lose the point completely. Either way, if you're not calm and you're not collected, and you don't really have a plan of what you're going to say, it's going to sound really disorganized. So my tip is that at the very least, if something comes up that you're not anticipating, take a deep breath before answering. And if you really need to, take 3 to 5 seconds to think about it before answering. They're gonna be okay with 3 to 5 seconds. And lastly, on the topic of nerves and anxiety, remember that you are evaluating them just as much as they are evaluating you. I know that sounds perhaps a little egotistical, but it is true. Obviously, don't go into your interviews with an arrogant mindset. That is not the point of this. I just know that a lot of you guys watching my videos are feeling anxious, and you will continue to be anxious when you're sitting in that interview room. And so I know at least this mindset that I'm also kind of evaluating the school helped me feel a little less anxious, because you know, I also have a little bit of that control. Your application was obviously good enough to get to the interview stage, and so the interview stage is just an opportunity for them to get to know you a little more and for you to get to know them. So just be confident and put your best step forward. I know that is impossible to think about when you have a million thoughts in your head and you really want to get into medical school. I get it. I've been there. But all you can do is prepare well, put your best foot forward, try your best, and everything else is kind of out of your control. And that brings us to the end of this video. If you found this video to be helpful, please give it a thumbs up and subscribe to the channel down below for more videos like this. And with that, I will see you guys in the next one. Bye!